हेलो एंड वेलकम टू आरोग्य फिजियो टिप्स। आरोग्य फिजियो टिप्स में आपका बहुत बहुत स्वागत है। आई एम डॉक्टर दिलप्रीत एंड इन दिस वीडियो विल बी टॉकिंग अबाउट एक्सरसाइजेस टू डू इन phase 2 rehab of TKR patients. Phase 2 is basically from week 4 to week 8. This is a series of videos, so if you haven't watched our video on phase 1, please do not attempt these exercises. Finish with phase 1 and then start with these. This is called a prone straight leg raise or a prone hip extension. So you will be lying down on your stomach. All you have to do is lift your leg up straight without bending your knee. So you will not bend your knee. Leg has to be absolutely straight. You will lift up from your hip as much as you can and down. So initially just do up and down. Make sure your pelvis is flat on the floor. You shouldn't be lifting your pelvis up. It's just your leg as much as you can go. Once you're comfortable with up and down, try and hold it up here for 5 seconds. Slowly come down. Again, 10 to 15 repetitions. The exercise is called prone knee bending. Again, you are in the same position, lying down flat on your stomach. All you have to do is bend your knee as much as you can. This is phase 2, so by now you should be easily bending your knee up to 90 degrees. So bend up to 90 and then try a little bit more to get it up to at least 100 or 110 degrees. Again, hold this position for at least 10 seconds and then slowly go back down. Again, 10 to 15 repetitions. This is the straight leg raise as we have done in phase 1. But now you will be adding an ankle cuff to a maximum of half kg initially. So you tie it around your ankle and then the same way you will just lift your leg up. At this point you can aim to go a little bit higher. Again, hold for 5 seconds. Slowly come down. Please just start with half kg. Once that starts feeling very easy, consult your surgeon and then progress to 1 kg. You just lift it up, try and hold for a few seconds and back down, 10 to 15 repetitions. This exercise is also the quad arcs that you did in phase 1, with the only difference is now that you will add the half kg weight cuff. Again, press your knee down on the pillow and straighten your leg all the way up. So hold it here for 5 seconds and slowly come down. If going all the way up is still causing trouble, just initiate the movement for a few degrees. Hold your leg there and down. You can also try to point your toes towards you, so that will also give you a calf stretch while you're doing this exercise. The next exercise is wall squats. So you will step away from the wall, around 2 feet away from the wall. Slight distance between your feet. Your back is flat on the wall. You keep your arms in front of you and go down with only 45 degrees in this phase and then come back up. Okay, no going all the way down. Just initiate it, go down 45 degrees and then push yourself up. Again, you can try to do around 10 initially. Next exercise is sit to stand. So you will just stand, make sure your calf or the back of your knees in contact with the chair. You will just bend your knees. You can bend your back forward and hold on to the chair and sit down. Again, you can use a chair with armrests in the initial stages. You can put your weight on those armrests and again push on those armrests and stand up. But always make sure you are in contact with the chair, so that decreases the chance of fall and you have a feedback of how much you have to bend to sit. Next exercise is seated knee extensions and flexions. So you will sit with a roll towel or a cushion in between your legs. You will press the cushion between your knees while you completely straighten your leg up. Throughout this process, you're still pressing on the towel and then come back down and release the pressure. And press the towel between your knees, lift and completely straighten your leg. If you can, try and hold it for 5 seconds and back down. Same way, you will come to the edge of the chair and try to bend your knee as much as you can behind you, all the way up, and then you can extend it. Again, bend it as much as possible and then extend it. For the next exercise, you will require a resistance or a loop band. You will tie it to the leg of a table or your sofa. Okay? And so this is a tight band which is elastic. You will loop it around your knee with your knee slightly bent. All you have to do is straighten your knee against the resistance of the band. So do it slowly. You will straighten your knee. Try to hold this for 5 seconds, 5 to 10 seconds, and then back slowly. This particular exercise you can repeat up to 20 times. This is important to prevent any contractures in your knee and to strengthen your quads. The next two exercises are for balance. So the first one is side walking. So just simply taking steps to the right and then taking steps to the left. So initially start with smaller steps and then you can progress to much larger steps. Progression of this exercise can be a little bit of distance between your knees, but slightly squat, just a little, and then do the side stepping in the squatting position. Again, you can do around 5 rounds to the left, 5 rounds to the right. This exercise is called tandem walking or heel to toe walking. Make sure you have the wall next to you to take support. All you have to do is put your heel in front of the toe of the other leg. So start out slow. If you are able to balance this way, take your hand off the wall and try to balance. Once the speed feels comfortable, you can go ahead and increase the speed with which you walk. Make sure you always have some support next to you. At this point in your rehab, you can start climbing stairs. So the leg that you have been operated on is the bad knee and the one which you haven't been operated on is the good knee. So the rule is always good to heaven and bad to heaven. So when you are going up to heaven, your good knee, which is the unoperated knee, being the left one in this case, will go up first. So you will always climb one leg at a time initially, and when you are coming down, the bad leg, which is the right knee in this case, will always come down first. Again, one step at a time. In case both knees have been operated, the more painful knee is the bad knee and the less painful knee is the good knee. So the same rule applies. If you've had a unilateral TKR, that means surgery in only one knee, do the exercises mentioned only on that leg. If you've had a bilateral or both knees, you can do the exercises on both your legs. If you feel any pain, discomfort or any stinging sensation around your knee, please stop with those particular exercises, and anything you do, please consult your surgeon before you start doing them. If you like our videos, just like, share and subscribe to our channel and witness your fitness with us.